Facebook, and on YouTube. We've been away from you for about 2 months, and we just couldn't stand the thoughts of not reaching out to you. So thanks to our kind sponsors here at Troit Cable, they are making this happen for us, and we really, really want to thank them for that. Now today we're going to bring you some very, very good information about 2 different topics. First, we have Amy Miner, who is the Chief Clinical Officer at Troy Regional Medical Center. She's to my far left. And we also have Dr. Eric Law, who is a family physician here in Troy in family practice. And during our first segment, we're going to be discussing COVID-19, and I'm sure that we're going to be able to answer a lot of questions that you've had about this. Now, the second portion of our program is going to feature Karen Herring, who is the Marketing and Public Relations Director for Troy Regional Medical Center. And her guest is Amanda Royal, who is the Director of TRMC's Wound Care Center. But let's begin now with Amy and Dr. Law. Dr. Law, tell us a little bit about what exactly is coronavirus.
Well, so the COVID-19 or the novel coronavirus, coronavirus is just a type of virus. They've been around forever. If you've had a cold, you've probably had a type of coronavirus in the past, but this particular type of coronavirus is new. It seems to have made a leap from animals into people, something people have never really had before. So we have very little immunity to it, and it seems to be fairly aggressive, at least in some people, in their lungs, in doing some damage, and can affect multiple organ systems. But the fact that we're passing it around a lot because we've never had it before, and the fact that it's fairly aggressive when it's in your lungs is what's causing the problem with high mortalities.
Mm-hmm. Now, what symptoms, Amy, do coronaviruses typically cause?
We normally see cough, shortness of breath, fever, runny nose. There can be several other symptoms associated as well, but those are the most common. We have had patients who have reported nausea, vomiting, diarrhea, those types of gastrointestinal symptoms along with the respiratory presentation.
Now, I've also read where it can affect your taste or your sense of smell.
It can. Taste and smell have been seen enough in the patients who have tested positive for the coronavirus that they do. Though they don't make the list always, they are pretty significant in what we're seeing.
Is that one of the most early symptoms?
It can be seen early, a lack of taste and a loss of smell.
Okay. And Dr. Law, why does COVID-19 cause a shortness of breath? You mentioned earlier that it really can affect the lungs badly. How does that work?
Well, so you get basically a viral pneumonia. The classic picture that we'll see on a CAT scan is a little bit of fluid and swelling sort of in the bottom of the lungs. And even sometimes even before you're short of breath, you'll start to show some of those sorts of signs on CT scan. So it's basically causing a pneumonia.
Okay, so even for people who are mildly or moderately ill, did they have some type of degree of impact on their lungs that could cause the shortness of breath as well?
Absolutely. And I think when you're talking about that sort of mild illness or early illness, it's still important to get it checked out. One, because when you're 7 days down the road and things may not be quite as good, you want to know, because it's going to take sometimes still 4 or 5 days to get a test back. And then 2, you want to know because you want to take care of the people around you, and so they know what they've been exposed to.
Right. Well, and that brings up a really good point. Amy, when should someone seek medical attention for this? When should they look for a place to go and be tested?
As Dr. Law said, if there's early signs of illness, reach out to your primary care provider, let them know what's going on, see if they feel like you need to come into the clinic or the office to be seen. But if your symptoms get really severe, if you're having significant shortness of breath, significant cough, maybe noticing a blue discoloration to the lips or the face, things like that, those are probably when you need to come to the emergency room. Let us take a look at you. Let us do a CAT scan and see what's going on in those lungs.
Okay. And how are these viruses transmitted between people?
Normally, respiratory droplet is the transmission source. Of course, we know as we cough or as we sneeze into the air, if we're closer than 6 feet, we can breathe in that air, and those particles are still transmitting, stuck in the air, basically. They can also fall onto surfaces, so that's why we're really careful about hand washing. We can carry the viruses on our hands, so washing our hands to make sure we don't touch our nose, our eyes, our mouth.
Now, when this first came out, there didn't seem to be a lot of evidence that young children were affected by this. Is that changing some now? How are they affected?
I think young children are definitely being diagnosed with the virus. Now, they don't seem to always be as sick as some of the older population. They don't have the comorbidities and the other conditions that Dr. Law mentioned that make them quite as sick, but they are definitely impacted by the virus.
Okay. Dr. Law, if people are asymptomatic, not showing any symptoms, can they still spread the virus?
So we were actually talking about this before we came on the air. There was a recent news report about someone from the World Health Organization saying that they maybe didn't think so, but I think there was probably a misunderstanding. What they were saying was that most people have some symptom, even if it's not a large symptom. I think there's very little doubt, and I think we've seen it even in Troy. I think I've seen it. People who have little to no symptoms spreading the virus. The early estimates have been maybe as much as 50% of the viral spread is coming from asymptomatic individuals, which is one reason we talk about wearing a mask even if you're not symptomatic when you're out and about.
Right. So if you have the virus, what's the possibility that you can be reinfected?
We don't know the answer to that yet. We know there are plenty of case series describing people who have definitely been infected and then are definitely reinfected. But we don't know for sure yet your natural immunoglobulins that you make against the illness, how protective they are yet.
Now, I know that we're going to talk a little bit later on about some of the higher risk categories, but one category that came to everyone's mind, of course, is women who are pregnant. And I know where I work, we had 4 soon-to-be moms, and we literally had to isolate them where they did not come in contact with anyone else. So what are we thinking when it comes to pregnant women? How dangerous, how concerning is this for them?
I think we're still taking similar precautions where we're trying to keep them as an at-risk population or a higher risk population. So far, the reports that I've seen have shown that they tend to do well, but it's not the kind of thing, obviously there's even fewer cases to describe in that population. So it's not the kind of thing we're taking chances with.
Okay, that's very good to know. I think that 3 of the 4 have gone back to their locations now. So speaking of the higher risk groups, what are some of those high risk groups, Amy, that we need to be cognizant of?
Definitely patients over 65 years old, those who have comorbidities, who have heart disease, diabetes, kidney, liver, any type of condition that makes them more susceptible to infection on a regular day. People who are on medications that compromise their immune system, immunosuppressants, those people are at a higher risk.
Okay. Should the people that are on an immunosuppressive drug, should they stop taking their medications, or should they continue with them as usual?
They should always consult their physician. The physician knows why you're on those meds, the significance of those medications, and whether the risk or benefit is more appropriate to continue or not.
And I think I would even add in the questions that I get most frequently, because it was some of the early stuff in the literature, is anti-inflammatories like ibuprofen or ACE inhibitor blood pressure medicines. There's been some data about those things. I feel relatively safe telling you, I think your risks, especially with the blood pressure medicine, your risk of stopping that is much greater than your risk of contracting the virus or whatever on it. If you're in an advanced care setting and you're very ill with the virus, that's a time they may talk about taking off an ACE inhibitor, that sort of thing. But for the general population, I think it's something they should continue.
Okay, excellent. Let's talk a little bit about testing. Dr. Law, tell us, when you think people should go get tests, and then how they need to go about that here in Pike County and surrounding areas.
So there are a few ways you can do it. So for one thing, I think there's a route calling the hospital. If you have an established primary care provider, the best thing to do is to call them first for a few reasons. One, they're going to help you make the decision of whether you need the testing, but 2, they're probably also going to make the process of getting tested easier. There are forms that we fill out frequently to keep the Department of Public Health informed about how many tests are being done. once you are ordered for a test, the process, thankfully, is very simple. We do all of our testing at our office through the hospital, and largely because they've really done well at making an easy system where there's minimal interaction, minimal exposure, and things have been going really smoothly.
Thank you. We have some stats as far as our hotline and some of the numbers that we've been able to collect. As of this morning, we've collected 917 COVID tests, collection of the swabs. We send that out, of course, to another lab for the actual resulting, but that's 917 patients who have come through either via the hospital inpatient ER or mostly through the hotline that Dr. Law referenced.
Is there a shortage of the test, or do we have a sufficient number here?
We currently have a sufficient number of test swabs. Usually the shortage comes in the reagent, which is the chemical analyzer that they use in the actual lab that processes the specimen. And the labs themselves are so overwhelmed right now. The volume of specimens that are being submitted, not just in Alabama, but across the country, is really bogging down the system. So right now we have plenty of supplies to collect those specimens, and then we send those, and unfortunately we're kind of at the mercy of the lab to result them. But it's about 72 hours now, which is pretty good compared to what we've seen in the weeks past.
And I know that the number of cases are going up. We're seeing some spikes. Is that a result of more testing, or are more people becoming infected, or is it a little bit of both?
I think it's both. Definitely the more you test, the more positives you're going to come up with, but I think definitely we are seeing the spread of the virus in the community. We're seeing more in the emergency room, more in the inpatient areas, so people are just getting sicker, which, regardless to the number of positives, we feel like we're definitely seeing a spread of infection.
And this test, if you perhaps have had COVID and didn't know it, if you were asymptomatic, can this test tell you whether or not you have already had it?
There's two different tests that are available on the market. The one we use for active infection is an antigen. So we're looking, we test for an active infection. There is another one that is an antibody test that once you've had the virus, your body should create antibodies that will show up, but it's not always immediate. It can be weeks and even probably months before you form enough antibodies to show up on that test. And that is not one that we are currently doing at Troit Regional.
Okay. What about false negatives, Dr. Law? Is this a possibility with the test?
Absolutely. False positives probably are very few, but false negatives are happening. And I know I've heard speakers from New York where, of course, they had just a horrible situation. And they were saying they were seeing CAT scans that absolutely were coronavirus. They'd test them twice and still get a negative. I think conservatively, even the send-off tests, we're probably seeing 10 to 15% maybe false negative.
Okay. With the limited testing that's available, because not everyone needs to be tested, correct?
That's right.
How do we tell people to assume that they have coronavirus or have been exposed to it without panicking them?
I think just, making sure that we take that we're smart, we use precautions. If there is a possibility that you have been exposed, make sure. Our masks are very important. We wear those in the healthcare arena every day, all day. We come into the building, we put it on. We encourage masking outside the building. We know that barrier between both people will eliminate some of the spread of infection. So if there's a possibility that you've been exposed, just take all those extra precautions to keep your family and the people that you work closely around safe.
Now, let's talk a little bit about protecting yourself. Let's go into that a little bit further. The majority of the women who attend Female Factor and who I hope are watching today are in some of these categories that we've talked about. And now we have restaurants that are opening back up, and we have different event venues that are opening back up. How do we keep them safe, or how can they work a little bit harder to make sure they don't come down with this?
I think wise choices. If you fall into some of those high-risk categories, stay home as much as you can. Distance yourself. If you do go to functions or restaurants or those kind of things, make sure that you are meticulous with hand washing, that you're spacing yourself away from others that are outside your normal household. Of course, you can ride in the car with the people that you live with and those kind of things, but others, limit hugs and greetings and handshakes still. I mean, we pass so much on our hands. But just being very careful with the type of venue that you choose to go to or the restaurant and the crowding, and also be aware of hot spots. Unfortunately, right now we hear that Montgomery County is what's being considered a hot spot, as well as some others around us. So try to limit your activity in those areas.
Well, I know for me that the hugging has just been awful. But we're going to take a little break right now, and when we come back, we're going to continue our conversation with Dr. Law and with Amy Miner, and we're going to take a little break. This is the Female Factor.
Hi, I'm Rick Smith, CEO at Troit Regional Medical Center. Your health and safety is our top priority. We understand that these are uncertain times, but one thing is certain: social distancing will go a long way in helping us fight the coronavirus if it's done correctly. Our staff of medical professionals want to take this opportunity to help explain exactly what social distancing means.
It means staying 6 feet apart, in line at the grocery store, the post office, wherever you are. Please stay 6 feet apart, away from the person in front of you or behind you.
Please don't shake hands or give a high five. Say hello or wave from 6 feet away, but do not shake hands with anyone.
Don't plan birthday parties, neighborhood gatherings, or play dates. Limit your contact to people that live in your household as much as possible. We know it's hard and we know you miss your friends and extended family, but this is not the time for a backyard barbecue.
Stay in touch with friends and family. Use calling, text, and FaceTime. Please do not visit. Please do not allow your children or teens to visit their friends either. Social distancing applies to everyone of all ages.
Stay home as much as you possibly can. If you do not absolutely have to leave your house, please don't. Please do not travel to another town or another state unless you absolutely have to. This is not time for a vacation, but it's time for a staycation. When you touch community use items like gas pumps or door handles, please use a napkin or wipe to avoid touching that item with your bare hands. When you are done, throw away the napkin or wipe. Do not reuse. Then wash your hands.
I'm Amy Miner, Chief Clinical Officer at Troit Regional Medical Center, and I hope these tips will help you understand the meaning of the important phrase social distancing. I'd like to thank you for doing your part to help us flatten the curve. We will get through this together.
And welcome back to the Female Factor. This is a little bit of a different format than you're used to, but we are very, very proud and very pleased and very thankful that one of our sponsors, Troy Cable, was able to make this happen for us so that we could still come and have a Female Factor with you. We are on Troy Cable Live. We are also on Facebook and on YouTube. So again, thank you for watching, and we're going to continue our conversation with Dr. Law and with Amy Miner now. Amy, you were talking about some ways that we could protect ourselves.
Absolutely.
What about viruses? Can they live on our clothing?
I think yes, studies show that it can live on fabric as well as other surfaces. Our guidance is just to, if you're out in public, once you get home, definitely change your clothes immediately. Wash your clothes. Normal laundering is going to kill the virus if it is there.
Okay. And coughing into your elbow,
Coughing
that's
into
always...
your elbow, covering with a tissue.
Right,
Yes.
okay. Hand sanitizer. Let's talk a little bit about hand sanitizer. That's been pretty difficult to come by.
Absolutely.
Of course, hand sanitizer is the first choice, but if you can't get hand sanitizer, what do we advise people to do?
Soap and water. Soap and water everybody's got that. That'll wash the virus right off your hands. You don't have to have the alcohol-based hand sanitizer. It's convenient. It's easy. We can keep it in our pockets, those kind of things. But just soap and water will take care of it.
Okay. So let's talk a little bit about bringing things into your home. If you go to the grocery store, is it necessary to wipe all of your groceries down? We've seen some videos that have come out on that, and a lot of people are making that extra effort to make sure that they wipe everything down. But again, with some of the cleaning products being hard to find, not everyone's able to do that. So what are your recommendations on those?
I think some wiping down when it's possible. It's not something I've stressed a ton, but if you've got a plastic container, maybe something came through the mail, that sort of thing, probably advisable to try to wipe it down. Fortunately, Some of the data that's come out now is saying that it's not as easy to get from surfaces as maybe we once thought, which is certainly good news, but not impossible.
All right.
I think along those lines too, it's personal choice and knowing how at risk you are. If you, I mean, a personal decision as to how meticulous with that you'd like to be.
Okay. And I think that there's been some confusion as to the terms that we've been using for some of the issues related to COVID-19. For example, what is the difference between isolating and quarantining? Because I think a lot of people are using it interchangeably.
So quarantine is when you think someone may have been exposed or you're trying to limit the spread, that's quarantine. If you're a known infected individual or someone who is not being tested, but we're going to presume that you have it, that's isolation. We're going to isolate you, keep you from interacting with anyone else until such a time as we can either test you negative or based on the timelines that have been laid out by the CDC, we can presume you're negative.
Okay, and are there different times as far as the length of time that you need to isolate versus quarantining?
Well, so quarantine, the way that I'm using quarantine for the most part is either while we're testing someone or really more likely until we can get a test to know for sure. Isolation, there are two different strategies. I'm trying primarily to do a test-based strategy. So in other words, I'm trying to prove that you have it and isolate you until I can prove that you don't have it. There are guidelines on 10, 14 days, depending on which organization you're looking at. But it's hard to be as sure. There are certainly cases that we've seen that people are still positive with a nasal swab at 3-4 weeks.
Really?
Yeah, and so a 2-week isolation is an assumption, and it's if you're so low on tests that we can't test, it's a reasonable thing to do. But if we can test, it's a little easier to tell people we know you have it, so we need you to isolate.
So if two people have this and they are living in the same household, can they stay in the same room or do they need to be separated?
So generally, I tell people try to keep the person who's thought to be infected or is known to be infected in a separate room, and try to keep that separation. If you have to come in contact, both people should wear a mask. You should wash hands liberally afterwards. But I try to encourage them to stay in separate rooms. You know, there are those situations like a minor coming down with it where I think it would be almost impossible to keep it from spreading to everyone. And I think it is a difficult situation. Once it's in your house, it's going to be hard to keep it from spreading. But if it's a teenager or a young adult or someone like that, isolation as much as possible.
Okay. Here in the South, the first thing that we want to do when we hear that someone is ill is we want to take them something, normally food or at least flowers or something. This makes things a little different for us, doesn't it? Talk about that a little bit, Amy.
I think it's still appropriate to reach out to those folks, to stay in contact, phone contact, whatever your chosen method of communication, email, text. But, and you can meet their needs. You can take food. You can deliver food. If they're isolated or quarantined to their home, maybe you can go pick up their groceries and leave them under the carport or on the front door steps or something like that, and not interact directly with that person, but still evaluate what their needs are, and try to help meet those needs.
Okay, that sounds good. We've also heard a lot about contact tracing. Can you guys talk a little bit about contact tracing and tell our ladies and our audience exactly what that entails?
Largely right now it's being done by the Department of Public Health. They are overrun trying to do it. And so, for instance, if your place of employment, I think most employers, and now even some churches, now that churches are coming back in, they're trying to have a system by which they could contact trace. So if you work in a certain department, everyone in that department may be informed, we have a positive test, and so these are the steps we're going to take. Similarly, I've seen churches where they have assigned seating, so if you're in section A, you may be contact traced later on.
And churches do have assigned seating, whether it's formal or not.
Yes, they do.
There's a
Definitely
name
get
on
that
that
in there.
pew.
That's
Yeah.
right, that's right. I think you have some stats for us, Amy. Can you share those
I
with
do.
us?
I mentioned earlier, at Troy Regional Medical Center, we have tested 917 patients since mid-March or so. Of that 917, we've had 130 patients who have tested positive. So as you look at the Department of Public Health website and those daily reports that come out, and you can see in Pike County, as of today, there's been over 2,000 tested on that graphic that it shows us. That's because there are other clinics and other facilities in Pike County who are doing their own collection.
Right.
So we have collected 917 of that 2,231, and we have 130 of the positives that have shown up for Pike County. You know, ironically, it looks like it's about half and half, maybe about 53% male, 47% female. 50% black, 50% white. The age variations, you know, it's pretty scattered. We've got 15% or so that are 20 years old and younger that have tested positive with us. 25% have been 20 to 30 years old. So that's probably the biggest group that has tested positive. You know, the older patients, 60 years old and older, are much smaller percentages, but oftentimes we see those being the ones who are actually admitted to the hospital.
As we go forward, I know we've heard a lot of talk about the new normal. Couple of questions. Number one, are we going to see this again? And number two, how do we go forward with things like fall at a university, people living together in close quarters, sporting events that everybody has been waiting to go to, weddings that have been postponed, family reunions that have been postponed. Let's talk about, number one, you think we'll see this again?
I'm not sure it's going to go away. I'm not sure we're going to get that big of a lull in it. Now, come August, you know, when we've had heat for a long time, maybe we see it back down a little bit. But right now, we're picking up pace. We're spreading about as quickly as we have in this region of Alabama. So I definitely think it's here.
So
for
do
the
we think the
foreseeable
heat
future.
affects it at all? Or is
I haven't seen it that much.
Okay.
I think maybe there's some benefit. I definitely think if you're able to interact, if you're going to interact, do it outside. I think there's value to that, but I'm not putting a lot of hope in heat killing it off.
Okay. So our new normal going forward, how does that look? What does that look like?
I think masks are going to be a big part of that, just to protect. We know the mask alone does not completely protect, but if both parties, the infected and the non-infected, are masked, we at least cut down the chance of transmission there. And then I think just the different way that we do things. You know, in the hospital, we have limited visitation, and it's a totally different world to take care of patients and not have those families coming in and families interacting. And I mean, the families are just oftentimes as big a part of the hospital world as the patient. So we've had to figure out how to better communicate, and sometimes that's FaceTime and, you know, doing other means of communicating, and that's in our homes, you know, virtual meetings just like this to still get the message out and interact with our community, but just not so close together.
Yeah, I think going forward, we are going to see a lot of changes. I know I have a lovely 84-year-old, and she's going to kill me for saying this, but an 84-year-old mother-in-law who had never had a debit card.
Oh, wow.
She now has a debit card, and she orders her groceries online. And then she goes and she gets one of my sons to take her to pick them up. She doesn't even want to drive. She can, she just doesn't want to. And so I think we're going to see a lot of new normals. I know at the bank we had our electronic banking products just jump tremendously because people were able to do their banking through ATMs and through mobile banking and through online banking. So that really cut down the need to come to the bank. So I know that we have been operating in a much different way. And even though our lobbies are open now, we still have the majority of our traffic to come through drive-through. We learned to do a lot of things through drive-through, like notarize documents through the drive-through. But I think that we're all gonna see something like that. We're gonna take a commercial break in just a second, but I really want to thank you guys for coming on and hopefully answering a lot of the questions that you might have had about COVID-19. It's complicated. It's It's overwhelming, but it is something that we can definitely get through. So thank you so much, Dr. Law, and thank you, Amy, for
Absolutely.
being
Thank
here
you.
today. We're going to go to a commercial now.
Troy Cable Security Wi-Fi doorbell camera allows you to answer the door from your smartphone when you are at home, at work, or on the go. When a visitor presses the button, Troy Cable Security sends a live video feed to your smartphone so you can see, hear, and speak to the person at your door. With the doorbell camera, you can have your porch light turn on automatically when it detects motion at night to create the appearance that someone is at home. You can view video clips so you can always know who stopped by when you are out. Troy Cable Security. You love them, protect them.
A personal touch, a high level of trust. Whether it's checking and savings accounts, personal or business loans, or our local friendly service. That's what Troy Bank and Trust customers expect. But now we offer more. Free identity theft protection for our new and existing customers, protecting your family's time, money, and good name from identity theft. Because protecting your identity is now a big part of our identity.
Oak Park Dental in Troy offers general and cosmetic dentistry. Schedule a visit with Doctors Blackman, Eads, or Miller if you're concerned about a dental condition, need a routine cleaning and examination, or desire cosmetic services such as whitening, bonding, crowns, and veneers. We also offer Botox and Juvederm.
Hi, Sandy. I'm right here. Come on in.
Baby, I'm right here.
Miss Mary, I'm right here.
I'm right here.
Since 1969, we've been right here because at Troy Regional Medical Center, we take these words to heart.
I'm right here.
Thank you. Remarkable people, remarkable care.
Thank you for joining us for the second half of Female Factor today. As Diana mentioned earlier, if you were with her during the first part of the program, we're coming to you live from the studio at Troy Cable, and we appreciate them so much broadcasting this information in this very informative session. We miss seeing all of you. Glenda Grissett and the dining room crew said they sure miss fixing lunch for you, so maybe all of that will be back to some sort of normal in the next couple of months. We appreciate you spending your lunch hour with us, and even though we miss hosting you, it's great to have Troy Cable do this program for us and create the situation where hopefully we can provide some very important information. I have two special guests with me here today. Some of you met Amy Miner during the first part of the segment, and Amy stayed with us to talk to us just a little bit about some new services that are going on at Troy Regional Medical Center. And the young lady in the middle is Amanda Royal. She is Troy Regional Wound Care Program Director. Both ladies are registered nurses, and we respect their field and certainly appreciate them being the front line during this COVID-19 crisis and everything that they're doing for us. Thank you both for being here with us today. We appreciate it. And we just want to talk a little bit about the latest service that's being added to Troy Regional Medical Center, which is the Wound Care and Hyperbaric Medicine Center. Amy, can you tell us a little bit about what wound care means for the community and what decisions brought that to the Troy Regional campus?
Absolutely. Our goals at Troy Regional are to definitely meet the needs of our community, and through some analysis and studies, we determined that wound care is something that this community could benefit from being provided locally in Troy. There's a fair number of patients who are having to travel outside of Troy to get their wound care needs met. So we partnered with a company and several of our physicians here in town to bring this service here so that our patients can have their health care at home and let us take care of those needs here versus having to travel.
Perfect. Thank you so much. And Amanda, welcome to Female Factor.
Well, thank you for having me.
And welcome to the staff at Troy Regional Medical Center.
Thank you.
It's always nice to add these new faces and this new talent and different views and different energy. So thank you so much for being here. Can you share a little bit of information with us, please, about what wound care specifically is, and maybe share some information about your staff?
All right. Well, first, I just want to say thank you for letting me come on and just kind of explain a little bit about our wound care program. Really, with our staff, it consists of physicians and nurses specialized in wound care. Right now, we've got Dr. Richard Slammer. He's our medical director. And then we've got Tom Purifoy. Dr. Purifoy also comes to us as a specialized wound care. We have Miss Ashley Williams. She is a registered nurse. She comes to us with about 10 years of experience with not only wound care, but actually home care experience with that. As the program director, I'm also a registered nurse, and I have about 10 years with home care settings, and then a little bit more few years with a hospital setting too. So we kind of have a variety of experiences that we're going to bring. Our team is just really geared to, kind of helping the community kind of see what the wound care system is about. One of the importance of our center is that a lot of people don't know that between 5 and 7 million Americans experience at least one form of a non-healing wound. And most of the time we've had to travel either to Dothan or Montgomery. And that consists when you have a non-healing wound that most of our patients we see once a week. And that is a lot on our patients to have to drive back and forth. So that is one of the big things is just letting people in Troy, Pike County, and the surrounding areas to be able to have that ability to come here and just have an extension of the quality of care and keeping them able to reach that goal for them.
And for us non-clinical people, can you explain just a little bit, you or Amy, and Amy chime in please at any time.
Amanda's the pro.
Okay, so Amanda, tell us a little bit about a non-healing wound. Because, a lot of us have a scrape or a scratch, and the older we get, then the longer those wounds take to heal. But for something on a perpetual basis or a wound that would bring us into what we kind of term as the emergency room for wound care.
That's right.
Tell us what that might look like, or what a person might experience that would create that wound.
So a lot of times with non-healing wounds, if you get a cut, within 2 weeks it should be healed. But sometimes the wound just kind of lags, stays in a process that's not going to heal that wound. If you have a wound that's over 30 days and it's not healing, then that's something that we need to look at. A lot of times we say non-healing chronic wounds, which after 30 days kind of meets that standard of a chronic wound. But then we also have acute wounds, which, maybe you have a burn, maybe you have a really deep laceration or dog bites. Those are also wounds that we will actually take care of also, because burn, you have to kind of go in and scrape some of that dead tissue off to get it revitalized, living cells, and help it kind of speed up that process and the growth factors with healing that wound. So it's a lot of different things. And so we want the community to realize that it's not, you don't have to know what a non-healing wound is. If you have a wound that is really bothering you, that's not been healed in 14 days and a normal reaction to a wound, then call us up. I know that's one of the things that, a lot of the people that we've talked to want to know, well, how do we get into the wound care clinic? And you do not have to have a doctor's referral. You can walk in, and then we kind of take it from there. We do an evaluation. We kind of look at what is going on with that wound and why hasn't it healed. And from there, we do a like a specialized standard where we kind of just go through the patient's history, physical, and then make a care plan specialized for that patient. And then from there, we do a lot more labs. With the doctor, they kind of go in, they look at what's going on. And so it's like we kind of say, we take care of the whole patient, not just the hole in the patient. And so that consists of a lot of different things.
And I know you were, I don't want to use the word excited, but you were pleased recently to help a patient that came to see you all with a wound, and some discoveries were made about that patient, and your office was so excited to be able to help this young person move forward with a diagnosis and some treatment. Can you share, without any HIPAA violations, can you share with us just a little bit about what transpired there and why y'all felt so rewarded helping this patient?
So we, like I said, not only do we go in and we, kind of look at why this wound is not healing, but even with, young people, just say we had a person come in their 30s. we look at, kind of what was going on. Why did he get this wound and why hasn't it healed? And so diving down deep and getting to know your patient, he's never had a primary doctor. He didn't have insurance for a little bit. Then he had insurance. He didn't really know how. He's been going in and out of some ERs. And, just not really looking at the benefits of having a primary doctor. So we educate our patients on the reasons why we need to set them up or have them get in touch with some of the local doctors, and then just kind of go from there, walking in. Why do we look at, we covered some other history information where he had diabetes. It was kind of uncontrolled, and so we kind of do teaching with diabetes, and then we get them referred out to actually an educator specifically on that. From there, we just kind of, went down the list of, we start from why didn't this wound heal, and then we uncover all these other different things that we can help with our patients. And so that's kind of the one thing, working with other resources around Troy and getting them hooked up, because a lot of times people don't have the education of where to go to find this. And, his mom was very impressed because she didn't even really know how to help him, because, sometimes I say us 30-year-olds, kind of getting later in that, but, we're hard-headed and think that we're going to live forever and we don't need to do certain things, but to educate on why and the preventative things that we can do to help the quality of these people's lives.
Perfect. And where are you located?
So we are located on Troy Regional Medical Center campus. We're kind of just, I always tell everybody we're right across from the helicopter. I can look out and see the helicopter leaving and coming. And so really it's 1320 South, 231 South. I was fixing to give you my actual address, so I won't do that. But, and if you have any problems, you can always call us, because we're always walking people through. Our number is 334-566-0546. I will give you directions. I will tell you how, and then if you get lost, you can pick up the phone and call me, and I'll get you there. We'll walk outside and wave.
So great service.
Great service.
On the phone and when you get there also.
That's right. We treat you like kings and queens.
We do appreciate that. Amy, is there anything else that you can add to wound care or other things that are going on at Troy Regional Medical Center?
Just really excited to have Dr. Slammer and Dr. Purefoy joining our wound care team. Both are very qualified surgeons and will do a great job in managing these wounds. I, as a home health nurse by background, definitely like Amanda and Ashley in the clinic, we know the prevalence of wounds, whether those are diabetic ulcers or venous stasis ulcers, or, as you said, dog bite and burn. We see those as home health nurses. We go into the home and try to take care of those, but you need a physician's touch, and you need the specialized medicine that wound care will be able to provide. And hyperbaric medicine is one avenue that we're going to also be adding to the wound care center in the coming months. We don't have an absolute timeline to share with you yet, but our doctors are being specially trained in hyperbarics, and we will have state-of-the-art ability to further heal those wounds and work on those individualized treatment plans.
Amy, for those of us that don't quite understand hyperbarics, I always want to make it another word. I'm really working on that term. Please explain that chamber. I know it's probably from derivative of a diver's chamber from movies we've watched, but if you can explain that a little bit better, and I believe ours will be state-of-the-art with maybe media even included.
Absolutely. I think Amanda may be able to better describe what's available now, but yes, there will be media available. There will be TV. There will be access to plug in your iPad or your phone or whatever for the period of time that you're in there. Very comfortable, but also providing those high level of oxygen therapy that help heal wounds. Amanda, you want to take a little more detail on that?
So, at Troy, we're going to have 2 chambers. And so what that's kind of like is when we look at these wounds and they are not healing, even when we've done all of our specialized, all of our testing, we have to go through a list of why did this not heal, and is it appropriate for hyperbarics? And so from there, we'll get a list, and we keep checking in different things with the doctors of, will this patient benefit? And so if it is determined that we've done everything that we can to get the wound into that healing process and it's just not really getting there, that is when we will go through and then have the hyperbarics. We have a specialized tech that's going to be there. She's going to be specialized in everything related to hyperbarics, and then our doctors are also going to be, like Amy said, specially trained on how. But it is like the divers, and that is something that was really neat for me when I got to go and get certified. That is exactly like getting the bins. People would go into the chambers, but this is just different. It's 100% oxygen, and it's going to target those hard to reach areas. You still need blood supply, but it's going to push the oxygen and force it into the plasma, which is a little in depth, I know. So I won't go into details about that because I like how it works. But it is going to be very comfortable. The sessions are going to be different according to what we need to do for that special wound that they have. But, you know, sometimes it's 90 minutes, and you go in there, we'll play a movie or whatever. But it is something that we're excited about bringing to Troy.
And Amy, I've heard the word specialized more than once during this conversation. So specialized, I'm assuming everyone was specially trained.
Absolutely.
I'm assuming that this is a licensed facility. Hoops that Troy Regional, of course, passed through with flying colors, and so there's a lot of work went into opening this center.
Absolutely. We, of course, went through the Alabama Department of Public Health as far as approval, and we are Joint Commission accredited. This department will be function as a hospital department of the hospital, an outpatient department of the hospital, and they fall within our Joint Commission accreditation. And you know, it is state of the art. It is safe. It is very hopefully convenient for the patients in our community to come here and see us and have those physicians and staff who have been specially trained to take care of those needs.
Great, and the name Slamer is so familiar in our community, and Purefoy also. So we want to thank you both for staying with us. Amy, thank you so much, and Amanda, welcome to the team.
Thank you.
We appreciate it, and again, we thank you for being here. We're going to take a short break, and then Diana and I will be back to wrap things up.
Troit Cable Security makes it easy to stay aware and stay in control of your home wherever you are. User-friendly interface allows easy navigation for lights, locks thermostat, video, and garage doors. Never worry about leaving your garage door open or the front door unlocked. Your mobile app can send alerts to your phone for alarm and no alarm events. Know when your children arrive home from school with video response. Make sure your home is powered by Troit Cable Security for ultimate access, awareness, and protection.
Have you seen an increase in your insurance premiums or significant change in your insurance coverage? Let Sandbeck Insurance offer you a better plan to suit your business or personal needs. Sandbeck Insurance offers many lines of insurance. Whether it's home, farm, or auto insurance, work comp, business, or health and life policies, Sandbeck is here for you. Call or visit our Troy, Enterprise, or Andalusia office today. Sandbeck Insurance, where we take pride in taking care of your insurance needs.
Don't settle for slow internet in 2020. Everything is quicker when you think Troy Cable. With our state-of-the-art internet network, you can upload and download large files quickly. You'll bid buffering farewell when you stream your favorite movies, TV shows, and music. Enjoy local, friendly, and knowledgeable customer service when you need help. When you think internet, think Troy Cable.
Your family's smiles deserve only the best. At Oak Park Dental, we deliver cutting-edge treatments that improve oral health and develop amazing smiles. Doctors Blackman, Eads, Miller, and her team are compassionate and patient-centered. We offer comprehensive dentistry Monday through Friday with 7 a.m. appointments available.
Thank you again for staying with us. Welcome back to this very different type of female factor. We're, again, very fortunate and very grateful for Troy Cable for working with us to make this happen. We've been away from our ladies entirely too long. We definitely wanted to bring you something today. And that kind of brings us up to where we are with Female Factor. We were talking earlier, and To be honest, we're not sure exactly what Female Factor is going to look like in the next few months. I will share with you that we have John Ed Matheson booked for our September meeting. We are very hopeful that we'll be back in the studio. Like I said, it may look a little bit different. We may be spaced out a little differently than you've seen in the past, but we're keeping our fingers crossed, and we need for you guys to send us your positive energies that we'll be back on track by September. We also are trying to get a human trafficking expert to come in for our October meeting, and we already have November booked with a recycling program with Stephanie Baker from KW Plastics. And then since that falls on Veterans Day, we're also going to have some Veterans Day acknowledgments and a very patriotic part of our program. But as for July and August,
we are wide open, folks. So if you have something that while you've been at home during this quarantine or during the stay at home, and you have some program ideas, Diana and I would love them. Just call us, same number as making a reservation, 670-5487. Send Diana or myself an email, and we're open to new ideas. We're open to new programming. On our 10th anniversary, so for 10 years we've been brainstorming and coming up with these programs, but now that the new normal has come along, we're just trying to adapt to the new normal, and also keep you in mind. Your safety during these times is utmost importance to us. As much as we miss you and as much as we all miss being together, we really have to remember the safety. And I just want to reiterate some of the things that Amy Miner and Dr. Law brought to you in the first segment of the program. Just because we parts of the country, parts of the state, parts of the city are reopening, do remember to be vigilant in your in your protection of yourself, in the protection of those that you live with or those that you're friends with. Just remember that we still need to wear our masks. We all have ours in our pocket. We also, hand washing, we've become so obsessed. I looked at my poor fingernails, and I don't know about Di, but, you know, those of us at the hospital have very few left. So it's just things that we've sort of adapted to. And you know what? As humans, that's what we've learned to do for centuries, is adapt. So we're gonna be stronger for this. We're gonna come out on the bright side of this, and we're gonna look back in a year from now and say, wow, that was a learning curve, but we were all on it. We were on it together.
So we are thinking through the next couple of months and how we can best serve you and how we can continue to be the female factor, all the factors that make us uniquely female. And I think of all of those factors, flexibility and adaptation, they're probably at the top of the list of being a female. Those are things that we do really well. So we are going to continue to be there for you and to try to bring you information that you can use, information that you can work with. And like I said, it just may look a little different right now than normal, but we are still here with you, and hopefully, if not before, we'll definitely be together in September when we welcome back Dr. John Ed Matheson. He's always a crowd favorite, and he's excited about coming, so we've just got to make sure that it's going to be the safest thing for all considered.
Absolutely. And again, if you have any ideas, if you've seen something that was of interest to you, please call or send us an email, and we would love to hear from you.
I'm just going to give a short shout out to all of our sponsors. Of course, Troy Regional Medical Center, Troy Cable, Troy Messenger, Ideal Graphics, Gibson and Carden, KW, Troy Bank and Trust, Horn Beverage, Jones Medical Supply, the Troy Pike Cultural Arts Center, Sandbuck, Family Eye, Center, Troy Health and Rehabilitation, Shackley, Oak Park Dental, the City of Troy, the Pink Parlor, WTBF, and our newest sponsor, South Alabama Electric Co-op. We've missed you, ladies. We hope that you have enjoyed this. It's been our pleasure to be able to bring it to you. And again, thank you so much to Troy Cable for hosting us. And we'll keep you posted on what's coming up for June, for July, and this is June, I'm sorry, July and August, and on down the line. So thank you again, Karen. Anything
Thank
else?
you. Be safe. Know that if you need us, we're all here for you. And remember to please use your local restaurants and shopping establishments and the sponsors of the Female Factor, because quite frankly, we wouldn't be here without them. So stay safe, take care, and take care of each other.
Bye-bye.
Troy Cable Security Wi-Fi doorbell camera allows you to answer the door from your smartphone when you are at home, at work, or on the go. When a visitor presses the button, Troy Cable Security sends a live video feed to your smartphone so you can see, hear, and speak to the person at your door. With the doorbell camera, you can have your porch light turn on automatically when it detects motion at night to create the appearance that someone is at home. You can view video clips so you can always know who stopped by when you are out. Troy Cable Security. You love them, protect them.
A personal touch, a high level of trust. Whether it's checking and savings accounts, personal or business loans, or our local friendly service. That's what Troy Bank and Trust customers expect. But now we offer more. Free identity theft protection for our new and existing customers, protecting your family's time, money, and good name from identity theft. Because protecting your identity is now a big part of our identity.